Now let's go into lab. If you damage liver, you are going to find 3 laboratory syndrome. I'm going to ask this question next year, but I'll explain a little bit because you might get this. I don't know. So first thing, if you damage liver, you are going to block the synthetic function. So first syndrome, laboratory syndrome you find is called synthetostatic syndrome, which means what? You get hypoalbuminemia. You have low clotting factors, which mean clotting assays and other tests will be defective. For example, prothrombin time 14 to about 14 seconds, or you can call it from 11 to 14 seconds, that will be increased. INR will be increased. If you go for specific analysis of clotting factors, their concentration will decrease. Why? Because liver is producing them. So hypoalbuminemia, decreased amount of clotting factors, so special tests which we run, PT, INR, APTT, you can put all of them as synthetostatic syndrome. If you lyse the cell, you have cell injury, cells will be breaking down. What will leak from the cell? Whatever is the appropriate content will be leaking from the cell. And we already studied in first class of pathology, yes, in cell injury, markers of cell injury we studied. Myocardial infarction, what increases? First myoglobin will increase, after that CPKMB will increase, yes, troponin will increase. These are markers. What about liver? Liver will be having enzymes too. More specific enzyme comparatively will be ALT, alanine transferase. A less specific one will be AST. So that is aspartate. So usually you will be getting either of them can increase depending on the cause of the injury. I'm not going to explain. Next year we are going to differentiate. This is called laboratory differential diagnosis. I'll be asking you to differentiate alcoholic hepatitis from viral hepatitis. There we will be detailing what will increase, how much it will increase. Here you should know they are increasing, which means cells are breaking down, enzymes are coming out, at least ALT and AST. What is this syndrome? Cytolytic syndrome. Cell is breaking down. Next thing, if you remember, if you have liver disease, there is going to be cholestasis, which means biliary obstruction. What will come out? You will have hyperbilirubinemia, which should be there, direct type of bilirubin. If you remember, esterified cholesterol is drained into bile, which means you can have increased level of cholesterol in case of biliary block. Why? Normally only one effective way of throwing cholesterol from your body is what? Bile only. We don't have any other effective mechanism. This is the reason for development of atherosclerosis. Some animals have some other special mechanism, so they don't develop. We don't have anything special. So for cholesterol and heavy metals, keep it in mind, once the heavy metal is coming into your body, you cannot throw it out. Only one effective way of throwing it out is through bile. If you block bile, they are going to come into your blood, so cholesterol can increase. There are other enzymes. These enzymes are expressed in the biliary tracts. If you have long-lasting stasis of the bile, bile has bile acids. They irritate. These bile acids are going to keep irritating the surface of this biliary tract. They increased expression of some enzymes. One is alkaline phosphatase. Second is gamma glutamyl transferase. We call it GGT. Another one is 5-nucleotidase. So if you have stasis of the bile, we call it what? Cholestasis. It is stimulating this biliary tract, and the cells which is located in the biliary tract, they are going to increase the expression of these enzymes. Number one is alkaline phosphatase. Second is GGT. Another one is going to be 5-nucleotidase, but we usually put 5 dash because where the nucleotide is going to be broken down by this enzyme, either in the third end or fifth end. This is technically the fifth end. That's why we call it 5-nucleotidase. So in case of cholestasis, you will have increased bilirubin. That is going to be direct bilirubin. There is increased cholesterol. There is also going to be increase of all 3 enzymes, not one, because all of them are increased. If you find only GGT is increased, This is not holeostasis, this is alcoholism. Because alcohol can induce the production of GGT. If you find only GGT is increasing, this is not holeostasis. In holeostasis, bile acid is going to stimulate the lumen of biliary tract. So all three enzymes will be increased in their expression. So ALP, GGT and 5 nucleotidase. All three should increase. So this is the answer for this. Many people ask me, yes, how to answer my interactive question. This is how you have to answer. So if you answer all these things, you get the full marks, because many people ask me, sir, we wrote. I know what you write.